their face look like how it is now. Now, I guess Soma Studio has. Let's have the first picture up. What I want to talk about, the first picture that we're going to have up is going to be of Kim Kardashian. She is the queen of reality shows. She's on the screen right now. Now, for a girl to get those cheekbones, to get that lips, to get that nose, what do they have to do? How can they look like that?
Well, most likely, if we look at Kim Kardashian's pictures from earlier in her life, she has had rhinoplasty, no question. Yes. Now, her cheekbones obviously very well delineated and well emphasized on this picture. And probably she also had cheek augmentation either by injections or some implants. As far as her lips are concerned, it will be difficult to be sure because a lot of people have genetically predetermined features that can result in this kind of lip configuration. So I'm not sure. Maybe the lower lip was a little bit augmented, so, but it was done tastefully. Sometimes people have lips that are really exaggerated. Now this is a good example of well-balanced cosmetic improvements.
Yeah, because you know, when I look at Kim Kardashian's, one thing that I love about it is about the fact that it's so well balanced.
Yes.
And we had a lot of girls that, you know, emailed us and they always ask us, is that can they get that face? But the question is, I mean, everyone's anatomy is different. So technically, you really can't have her face on your face.
No, of course, we have to do what we can do with particular anatomy of the particular patient. But again, there are some operations that result in distortion, exaggeration, and this is not acceptable.
Yes.
Her surgeries and treatments were well designed and well carried out. She has got very good balance of features, and of course she's very attractive with this.
She definitely is attractive,
yes,
absolutely.
Yeah.
Yes, now our next picture, she is the queen of the beauty, Marilyn Monroe, and that's definitely an icon/legend. Now it's funny because I am the master of beauty and I always talk about beauty, but we were in your clinic and you told me something that maybe many people like myself out there that did not know, that Marilyn Monroe did have a nose job.
Yes, yes, and this was from the times when a lot of celebrities recognized the importance of improving their appearances, but it was done behind closed doors. And that was the case with Marilyn Monroe. She had rhinoplasty, as it's quite evident on these pictures, and of course also rhinoplasty which was not exaggerated in the sense of the amount of change that was carried out there. She still has got relatively wide nasal base, but otherwise it's well-balanced nose, and of course she was recognized as a beauty icon.
Beautiful. Now, this picture here, this is Jenna. Jenna is a transsexual. She's a transgender. She was the first girl that made it into Miss Universe, Miss Canada this year. And as I told you, I did the hair and the makeup for Miss Universe, Miss Canada this year. And she was one of the contestants. Now, for a transgender, the question that I have is that how can they look like a real female? What surgeries are there out there for them to look like a natural-born female?
Well, I have worked with Clark Institute in the past and worked with this type of patients. And of course, facial features are very important apart from other body changes that they will undergo during that particular process. Now, in her case, of course, she had facial surgery for sure to emphasize the femininity and to create this softer, better look. Skin care, of course, hormones are also helping in that particular appearance. Definitely, this is another example how important cosmetic surgery, the surgery of appearance, is for some individuals. It has got vital importance for transgender patients who have to feel not only the gender that they want to show, but they have to show that gender.
Absolutely, because I mean,
facial features.
They're converting from being a male to a female. So I'm guessing now, is the surgery, is it harder to do a surgery on a male to make them look into like a female?
Well, yes, it is definitely.
And what do you guys look for?
Well, we have to look particularly on configuration of the eyebrows, framing of the eyes, the character of the nose. Character of the nose is very important because males obviously have stronger, bigger noses, whereas females have got more delicate, The angle between the nose and the upper lip is a little bit more obtuse in females than in males. So all these features of the nose can emphasize femininity or can fall short of that.
Yeah, because here we kind of zoomed into Jenna's face, and you know, you could just, she definitely has a female face now. Now, I saw Jenna's picture when she was a male, and she did not look like this, but what she told me that Aitous, I got her whole face reconstruction. So they shaved down the jaw, they shaved down the forehead, and she got her apple removed.
Yes, Adam's apple reduction is a frequent operation in that sex-changing patients. But also it's an operation that is done on females who have prominent Adam's apple and are uncomfortable with it. Some males, not transgender patients, also have Adam's apple reduction, which they
What
prefer.
are the reasons? What are the reasons? Why? What are the reasons that male come in and ask to remove their apple?
Maybe they are borderline people with regard to recognition of their sex, recognition of their gender. On the other hand, it is just purely aesthetic preference. Some people like to have high eyebrows. Some people have prefer to have very pronounced cheekbones. In the past, males put scars on their faces to emphasize their masculinity. So this is purely individual preference in such cases. But in gender changing individuals, Adam's apple is definitely a masculine feature, and if corrected, adds to the whole overall improvement of the appearance.
Yes, and now we have Jennifer Lopez, which she's so well known for her butt, but now we're talking about her jawline. Now, to have a jawline like that, what can you do? Can you do implants? Is there fillers? What's the best and the safest way?
Well, depends what jawline we are talking about. If we are talking about weak chin, under projected chin, we can improve the chin projection by various methods. Implants, by advancing the whole mandible forward, the jawbone. I don't think she had much done as far as the jaw is concerned. She might have had cheekbones augmented as well, and she might have had a rhinoplasty as well. But from this picture, one cannot be certain. I saw her pictures from earlier on in her life, and that nose may have been gently refined, and definitely the cheekbones were nicely augmented.
Now, I read up on Jennifer Lopez because she is one of my favorite celebrities, and what they said is that she has emphasized her jaw by Restylane, which is, I guess, a product that's injectable.
Yes.
Now, talking about Restylane, talking about products that are injectable, how long do they last and are they safe?
Yes. Well, Restylane, Juvederm, and alike products, as long as they are made out of hyaluronic acid gel, are probably the safest, because hyaluronic acid gel is a substance gluing our body cells together. So we have that particular substance in our body. And it means that if we add that substance to some parts of our anatomy, it will stay there because it is constructed in such a way as to resist the body's attempts at redistributing it, but eventually the body will redistribute it all over. So that is a temporary filler. It will last for up to a year. Some of them will last up to 2 years. So it can be injected in various areas. In her case, perhaps she had it injected in cheekbones mainly, possibly a little bit along the lower jaw as well.
Yes. Now, this is our final picture, the queen of the lip injections. Everyone always talks about Angelina Jolie lip. Now, do everyone come into your clinic and ask you, I want Angelina Jolie lips?
Yes, but you know, I have to tell you, I am somewhat in doubt whether Angelina Jolie had her lips injected. Because if you looked at her pictures when she was much younger, that was at the time when lip injections were not available, her lips were absolutely incredibly beautiful, as luscious as they are now. So probably she did not have lip injections, although she's setting a standard for this type of lip anatomy.
Yes. Dr. Conrad, thank you so much for talking to us about celebrities. This is something that many people are really looking to right now, and they're definitely wondering about what other celebrities, what have they have done. Now, we're going to go on commercial. یه music video actually اتفاقا میبینید. ببخشید. وقتی که برگشتیم, we're going to have a phone call for one of our viewers and they're going to ask you a question. So بینندگان عزیز, میریم الان یک music video میبینید. Here you're live on air with myself and Dr. Conrad.
Okay, well, thank you for having me, Aitous. And I just had a concern because I had some Botox done on my chin, and I got it done on my right side. And I usually get it done because my muscles are intense, and to relax the muscles, especially when I talk and everything, so it doesn't show so much reaction on my chin. And I used to go to one of my doctors who I always used to go to, which I don't really want to say his name, but I don't want to say anybody's name. But overall was I went to another surgeon, and he did 2 units on my right side and my left side around my chin. And then now when I smile, my right side is lifted.
So you feel that the Botox, I guess, is that an issue, Dr. Conrad?
Well, of course, the Botox was not distributed properly around the muscles that were intended to be attenuated, meaning the muscles that were supposed to be weakened. Now, if you there's a muscle that depresses the angle of the mouth, and there's muscle that actually keeps the lip in normal horizontal position, not depressed. And there are muscles, of course, that lift the lip as well. Now, the muscles that were injected sometimes are not affected in an even fashion, and that's why you have this particular problem. But I can only tell you that the best, of course, situation here is that it will be temporary. It will recover completely. So you don't have to worry about it being permanent or lasting for too long. And usually the amount of Botox that you receive there will not last for more than perhaps 2, maybe 3 months. So you should be back to normal. But in the future, I would not encourage you to have Botox injected in that area, because this is not the best area of the face to be treated with Botox due to sometimes these problems occurring.
Perfect. Portia, did you hear that?
I can't really understand him, but after I will call the show when it's off air, and I'll talk to you about it. But I just want to know, is it going to go away? Is my muscle going to go back to normal?
Yes, well, as I told you, it will go away. It will go away 100%. You'll be back to normal.
Okay, thank God.
Yes, you'll be back to normal within 2-3 months, maximum 4 months.
Portia, thank you for calling, and don't worry, for you hear from the master of the facial plastic surgeon, Dr. Conrad, so don't even worry about it. ایشون میگه که تا 2-3 ماه دیگه بعد از اینکه شما انجکت کردید صورتتونو، بوتاکس فقط برای 2-3 ماه میمونه، باز دوباره برمیگردید to your regular صورتت که همونجوری که بود. So don't even worry about it. سال دیگه عزیزم داری, because we don't have enough time, we gotta go.
Okay, well, thank you so much for having me on the show, and thank you again, Dr. Conrad, and thank you again, Aitous. I love you, Aitous. You're amazing, and definitely, Dr. Conrad, I'm going to come and see you.
Thank you very much.
Thank you, Portia. Have a great night. Thank you.
Take care. Bye-bye.
Well, Botox has been huge. I mean, we have a lot of people that do Botox around the whole face area. Now, I want to talk about Botox, but at the same time, I want to talk about age. From what age can you do Botox, and is there an age limit?
There's no age limit, and you can receive Botox at any age. Of course, it is usually injected in adults, and in earlier life, Botox was used for people who had some problem with the movement of the eyes, and that was probably the reason why we started using Botox in other areas purely for cosmetic reasons. So Botox was used for regulating the muscle tension in various parts of the face originally. Now we use it for cosmetic reasons. And you can use it at any age when it is indicated. Some of the young individuals have the tendency to frown frequently, and eventually there will be damage to the skin through frequent action of these muscles, and it is better to prevent it by weakening this particular action. But muscles that are responsible and very important for facial expression should not be treated. The muscles that create negative emotion and that is, or give the impression of negative emotion, and especially muscles with which we frown and raise your eyebrows, these muscles can be nicely attenuated with advantage.
Wow, so that's for بوتاکس. بینندگان عزیز داره قشنگ میگه که بوتاکس چیکار میکنه. و دوستان عزیز اگه بیشتر information میخواین یا if you did not understand many of the things Dr. Conrad has said میتونین قشنگ کلینیکش بری. حالا at the end of the show we're going to tell you exactly clinic Dr. Conrad where it is و کجا هست و چجوری میتونین ایشون رو کانتکت کنین. الان تو اسکرین تلویزیون this is I guess your teammate and this is your facility at Conrad's clinic which is located in
It is on Young Street at Major Mackenzie, and that's the picture of our operating room. We have 2 operating rooms and overnight facility as well.
Perfect. Now, Dr. Conrad, in the Persian community, you stated to me the main most popular perform in the Persian community is?
Rhinoplasty.
دماغ عمل کردن. So tell me, Persians, there was this statement you actually said to me. If between برگردیم, this is something really funny. You said, بکش منو خوشگل کن. You told me this.
Yes.
I want you to tell our viewers what Persian people always tell you. دوستان عزیز بیشتر از clients هایی که میرن پیش دکتر کانراد همیشه این یه حرف رو به دکتر کانراد میگن.
Well, first of all, I'm very lucky that I was embraced by Persian community, and that is mainly because of performing the rhinoplasties that has met with their approval. And rhinoplasty is the most intricate, most difficult perhaps out of all the plastic cosmetic operations that we perform on the human body, because it requires great deal of skill and artistic sensitivity, and also very good balance in the treatment and judgment on the part of the surgeon. So rhinoplasty is an operation very popular not only in other communities but especially in Persian community.
And most of your clients that come to you, they always say, "Bokosh mano khoshgel kon."
Absolutely. Well, of course, I try to sort of correct them on this because I would like them to live long and be beautiful.
از دست ما ایرانی‌ها که هر کاری می‌کنیم برای زیبایی. الان می‌خوایم در مورد nose jobs حرف بزنیم. اتفاقاً we have one more viewer that just called into the studio right now, Dr. Conrad. We're going to talk about nose job, but first, before we answer, we're going to go into the pictures, and this is what you've done to people that have nose problems. Now, I'd like you to start off with this young beautiful. How old is she?
She is 16.
Oh, wow.
She had 2 operations that were necessary because of early life injury. And after these 2 operations, this is the final result. Obviously, not very good. This is what I corrected for her. Her nose now looks normal. Her deformity is more obvious on the view from one side, that you can see collapse of the nasal bridge. And that was totally restored, and she has been quite normal and happy. And not only that she has got normal looking nose, but she also can breathe through it very well.
Dr. Conrad, I'm sorry, I have to know, how did you do this? This is like, I mean, did you have to implant her nose, or what did you do? If you add fillers?
Yes. No, various methods are available. We can take a part of the rib cartilage and implant inside the nose, graft it. And also, there are certain materials that are available, and especially one material that is suitable for this type of work, and it can be used as well. It is up to the discretion of the surgeon and, of course, preference of the patient, the method that can be used for augmentation, but whatever we use has to be safe and long-lasting without any problems.
Now, this is another client of yours. Now, what have we done here?
Well, this patient aged prematurely. She has got sagging of the facial tissues and also multiple etchings of her skin. So in her case, I performed total facelift with correction of the eyelids and forehead, as well as total resurfacing of her face with laser.
Dr. Conrad, right now we have Sarah on the line. She's calling from Texas, and I believe that's Sarah. Sarah Azam, are you online?
Hello.
Hi, Sarah. You're live on air. الان با دکتر کانراد هستین. عزیزم شما از تکساس هستین؟
الو ببخشید.
شما از تکساس. Are you calling from Texas?
بله من تکساس هستم. شما خوبین آیتوس جان؟
مرسی عزیزم. الان با دکتر کانراد هستیم. دکتر کانراد یکی از بزرگترین one of the biggest facial plastic surgeons to Canada, and I know you have questions, so we gotta wrap it up because we don't have time. Azam, go ahead and ask your question.
Okay, hi Dr. Conrad, how are you?
Hello, very well, thank you.
My question that I've been
If you have definite indications, meaning that your cheek configuration can be carefully assessed and predicted that if you have any augmentation, you'll be pleased with it and your appearance will be definitely enhanced, then I would go for permanent implant, which can be done without any scarring because the incisions are inside your mouth. And that implant, in case you don't like it, can be removed without causing any damage to your tissues. Now, if on the other hand you want to try the effect of the augmentation, you can use injectable material that will not create as good and natural look as a properly inserted implant, but will give you some idea. And in that case, you could use injectable material that will not last too long, so that then you can have the option of having proper implant used, or you decide that the augmentation is not for you.
Okay, and how is the process for it? How long is, to put the cheekbones in, how long will it take for me to get better on that? Like, what's the healing process on that?
Usually about a week, maximum 10 days, because there'll be some swelling after the operation. And if you have injectable materials, then of course it is an office procedure and there will be no downtime at all. The only thing is that injectable materials have got some problems at times that can be, at times, even of serious nature. So generally speaking, I would opt for implants.
Sorry to cut you both, Dr. Conrad. We don't have time. Sarah Jane, thank you so much for calling in. We don't have time. Now, don't worry, Dr. Conrad is going to come back on the show.
Sorry, Aitous, I don't mean to cut you off, but if I did want to come in to the clinic that you have, I saw it on Facebook that it's located in Toronto, right? And you got a place where I could stay there for the week?
Yes, it was stated on my Facebook that yes, we can do that. Sarah June, we don't have time, unfortunately, buddy. What I'm gonna do is I'm gonna give you an email myself, and I'm gonna email you all the information, or I'll post it on my Facebook once more, and you can call directly to his office, which is located in Toronto. Thank you so much for calling.
Thank you so much. Thank you, Aitous. Thank you, Dr. Conrad.
You're welcome.
Sorry about that, Dr. Conrad. We're running out of time. Let's finish with the pictures. So this is what we've done next, and this is for the faces that you have done. Obviously, you've done a lot. Now, this picture, I want to specifically talk about this picture because the nose, it looks like a Persian nose.
Well, it is a very attractive lady, so definitely I cannot reveal her nationality, but she could be Persian
yes.
because she's beautiful.
Yes.
Well,
of course, my Iranian hamish is ziba hastin. Dr. Conrad, us Persians, we're always beautiful.
Well, this nose obviously is quite strong on this beautiful feminine face. So, very well-designed reshaping, as shown now on the next picture. It created better balanced and much more feminine.
What a difference.
Nose.
You know, I love your nose jobs because they are exactly what Persian people want. Kemam migim arusaki, which is that dull, beautiful, chic, elegant look. Everybody, excuse me, that everybody wants. Dr. Conrad, let's go to the next picture.
Yes.
And this is her again?
Yes, from the other side. Next. And again here from the other side. This is not a sort of gouged out bridge, not a sort of ski slope. It's nice and straight profile that most people prefer because it is more elegant than really slopey looking bridge.
Yes. Now, having a rhinoplasty done, how long does it take for you to recover?
Usually about 2 weeks.
2 weeks, okay. So should they take off work? Is that 2 weeks of just, give yourself a vacation time, or can you lift stuff? Can you lift objects, or what is the consideration? Because a lot of people are afraid of getting a nose job because they think they're gonna have constant bleeding.
No, this is absolutely very unusual, and it's a complication that actually I don't treat too frequently, if at all. The strenuous physical activities can be resumed probably after 4 or 5 weeks after the operation. But normal social life can start as soon as the bruising and swelling, the main portion of it at least, disappears. And that is within 2 weeks.
Dr. Conrad, we have one more person online right now. Hello?
Hello?
Hi, you're live on air with Dr. Conrad and myself. Thank you for calling in. Go ahead.
Hi, Dr. Conrad. Aitous, how are you? I'm calling in from Vancouver. Actually,
Yes.
my mom and myself are a huge fan.
Thank you.
And she told me that you're having a plastic surgeon on air. Why?
Yes. We found the best of the best. It took us approximately 1 year to find the best, and we did.
No, definitely. You definitely did.
Thank you. What's your question?
The question was, I'm interested in finding out what the nose job and the recovery time for one.
Well, it's funny that you asked that because this is exactly what we answered. Dr. Conrad?
Yes, well, it takes about 2 weeks maximum 2 weeks. At times, if somebody has got tendency to excessive bruising, it may take 3 weeks, but usually 10 days to 2 weeks. And then, of course, another few weeks for resuming strenuous physical activities. But from the point of view of returning to normal professional and social life, 10 days to 2 weeks is adequate.